My name is Elyse Wild, and you are listening to Women's Lifestyle Magazine, Inspired Voices. Hey, welcome to another episode of Inspired Voices. I hope that you are safe and healthy, and I hope your mental health is good too. Today I talked to an infectious disease control doctor from Mercy Health Muskegon, Dr. Daniella Pellegrini, and she and I discussed the ways in which her life has changed as someone who works not only just in healthcare, but in infectious disease, of which COVID-19 obviously is. After talking to Dr. Pellegrini, it really drove home for me how important it is for all of us to do our part and stay home and adhere to the guidelines. You know, one of the things that she mentioned in our conversation is that we all have a great responsibility to each other right now. And I thought that was a really great way to put it. And even though we're frustrated, we might be bored, we might be feeling a lot of anxiety, and we just really might want to force our life back to normal by bending these guidelines, but it's just not the right thing to do. We all have a responsibility to each other, and I love that she put it that way. We also talked about how Mercy Health has prepared for what we've all been hearing about, the overwhelming of their systems due to an influx of COVID-19 patients. So I hope that you enjoy our conversation. Daniella's perspective gave me a lot of comfort, and I hope it does for you too. All right, today I'm joined by Dr. Dani Pellegrini of Infectious Disease at Mercy Health Muskegon. Dani, thanks for joining us today. I hope you had a great holiday weekend. And can you give us a little bit of background on what an infectious disease doctor does?
Sure. So an infectious disease doctor is a physician who has internal medicine training, and then once they've completed that residency program, it takes 3 years, they go on to specialize and train in infectious diseases specifically. So that can be anywhere from 2 to 3 years of additional training. And the goal at the end of that training is to be able to treat complex infectious diseases like HIV, bone infections, blood infections, and different kinds of viruses like coronavirus.
Wow. So can I ask you, what led you down that path in your medical studies?
I actually started at Mercy Health Muskegon as a nurse 20 years ago, and during my nursing at the hospital, I became very interested in the treatment of infectious diseases. And so 15 years ago, started up with schooling to be able to go back to medical school. So I went back to medical school 12 years ago and then came back to work as an infectious disease doctor here. So my whole healthcare experience outside of training has been here at Muskegon at the hospital.
Wow, that's amazing.
Yeah, thanks.
So we are continually hearing right now in the news that local hospitals are in great danger of being overwhelmed with coronavirus patients. And, that's something that a lot of people are, are kind of feeling that fear of that impending wave. And we're all wondering, like, are we prepared for this? Can you tell us how Mercy Health is preparing for that?
Yep. So I'm part of the administration. Not only do I see patients in the hospital, but I'm also an infectious disease administrator. So I help with infection prevention and stewardship of antibiotics and antivirals. And so what we're doing and what has been happening over the last 5 to 6 weeks is essentially nonstop planning. So we're in meetings all day, conference calls all day, pulling together all key players, whether it be nurse managers, physicians, administration, supply chain, security, you name it. All the key players are coming together every day, all day long. And our goal is to do exactly what you said, prepare for a potential surge, making sure that we can care for our community to the best of our ability. And so that means protocols are being implemented. We reevaluate those protocols, we adjust them and tweak them to ensure that we are keeping everyone at the hospital and all of our community safe in anticipation of a potential surge. It's working with local and state healthcare agencies and the government. We're always following up with whatever the CDC guidelines are, because those are ever changing and updated what seems to be daily. And then we also have Trinity guidance that's coming down from a state level that assists us with our protocol and our planning.
Wow, so you guys are very, very busy right now.
Yes.
So how are you feeling about the preparations?
I Initially, I think because none of us had a good sense of what this coronavirus was, we weren't sure how it was going to affect our community. I think everyone in healthcare can say that there was a level of fear that was unprecedented because we just didn't know what we were dealing with. And it's not to say that we have a good grasp of what coronavirus is now. There's still a lot of unknowns, but I think because we're on the west side of the state, we've had more time to prepare, and we've been able to kind of watch other states or other parts of our state even as they've gone through surges, and learn from what's happening even on the east side of our state. So we've had time, and that puts us in a better position than a lot of other hospitals across the country.
Yeah, that's been my sense, is that we have had a little bit more time, and as you said, you guys have been preparing for 5 or 6 weeks, and that in itself has personally given me comfort, that we've been hardcore preparing for a little while. So hopefully that's what ends up saving lives, is that preparation and the hard work you guys are doing.
Yep, I agree. It gives me comfort as well, because I get to see the collaboration between everyone every day, all day, and I think we're in a better position than a lot of places across the country with regards to a potential surge coming our way.
So with the preparations that Mercy Health is doing, I imagine that a lot of healthcare workers are really feeling the strain right now. How is Mercy Health supporting staff at this time, to your knowledge?
So safety is a core value of Mercy Health, always has been, always will be. And I think a big part of the fear that comes with the coronavirus pandemic is the access to PPE or protective equipment. And that is across the board. That is not isolated just to West Michigan. It is at every hospital, in every city, in every state. And so we have worked tirelessly to get our supplies, essentially reaching out to via any avenue to obtain as many supplies as we can, whether there be masks or gloves or gowns. And we are conserving appropriately to make sure that when we do potentially surge, we have enough PPE to last us through that surge. And again, because of time, we've had an ability to work through a lot of those plans and protocols so that we can do so as safely as possible. Our priority has always been the well-being of our colleagues. We need to make sure that their well-being is even in these times of unrest and uncertainty. We need to make sure that our colleagues are as mentally healthy as possible. Mm-hmm. And I think by meeting with them constantly, or meeting with them continuously to work through plans and protocols regarding the PPE, regarding where we're going to place patients, regarding our staff. I think that provides everyone a lot of comfort, because I think transparency is very important in these situations.
Yeah, very true. And it seems like that's something that is, to some degree, is what's coming out of this, is a level of grace and a level of transparency, to so everyone can share in what's going on, and that seems to be a little bit of a positive right now.
Absolutely. I think it's I've been in healthcare for 20 years, and I've seen teamwork and collaboration, but it is palpable as you walk the halls. I mean, everyone wants the same thing, which is taking care of our community, and doing so as safely as possible.
That has to be, as uncertain as this time is right now, and as hard as you guys are working, while also dealing with the fear of the worst, that does have to be a good feeling, that you are all united in the same goal.
Absolutely. And I think anyone in healthcare can speak to, while we have a very healthy respect for this virus and what it can do, there's also a sense of calmness. And I think anyone who works in a hospital can appreciate how important that is. Mm-hmm. So I think we can be a little more calm as we prepare, because again, the time that we've had to prepare has put us in a position to do so in a way that is deliberate, with every decision we make, well thought out and well planned.
Yeah, this is very well said. As someone who had a family member in the hospital for an extended period of time a couple of years ago, my dad had a cardiac arrest, and he's fine now, which is amazing. But one of the things that really got me through that emotionally was the calmness of the staff that was taking care of him. As he, told the line between life and death, it was really their calm approach that gave us comfort, and that, seeing them approach these situations with just calmness and clarity really was that was my first experience with that in a healthcare situation. And I really appreciated the skill that it takes to do that, and what a special thing it is that people in healthcare, I think, just inherently have.
Yeah, it's very important. And I think especially in a time like this where we're all navigating through this together, we need to rely on each other as staff, as colleagues, as friends, for our family and for our community to remain as calm as possible as we as we learn every day more and more about the virus.
Mm-hmm. What are the biggest challenges in your day-to-day work right now?
So I think working in a hospital, caring for people when they are their sickest,
mm-hmm.
very rewarding, but the day-to-day of that is stressful in and of itself, regardless of whether there's a pandemic happening or not. And I think even with those day-to-day stresses, we have historical data, we have guidelines, and we have experience to help guide us through how to treat, for example, complicated infections. Even if a disease process decides to not really follow the textbook, we can still rely on data and experience and history to help us as we navigate through the treatment of, like I said, a possible complicated infection. Mm-hmm. Unfortunately, I don't think the book on COVID has been written yet, and I don't even think we're in the first couple of chapters,
mm-hmm.
to be honest with you. We don't have years of data. We don't have guidelines to help us with how to treat or what to expect. We have some information, but it's not much when you look at how important years of information is with regards to other disease processes. And I think the biggest challenge from anyone that works in healthcare right now is just the unknown. We're not sure where this coronavirus story is going to take us. And I think that provides all of us a challenge because we like data, we like information, we like guidelines. And I don't mean to be doom and gloom about it. And this virus will burn itself out like other viruses have burned themselves out. But I think that's a huge challenge for anyone working in the hospital. Yeah. And I think another challenge is the social challenges that we have. I'm a little fearful about people potentially not social distancing the way that they mm-hmm. maybe were prior to the Easter holiday, and what that means for us from a potential surge standpoint is in the next few weeks we're really are going to be very telling as to how much people were gathering over this past weekend, and that's concerning to I think anyone in healthcare.
I'm sure, yeah, and we've been on our end with Women's Lifestyle Magazine, we've been really trying to emphasize what you can do right now to help is to stay at home and to follow the governor's orders. And that's how you can best support healthcare workers right now. And we can't emphasize that enough because we are all connected in this and we are all depending on each other to do the right thing. And that is a little scary because we've never had to do that before. We've never had to rely on each other so much for such an extreme thing.
Right. Yeah. This virus does not discriminate. Mm-hmm. People have said that over and over and over again. It does not matter how old or young you are. It doesn't matter where you live. Does not matter what race or female, male. It just doesn't matter. It doesn't care. And so I think we are so reliant on the community to help protect everyone. Mm-hmm. We all need to protect each other.
How has your life changed as a physician due to this pandemic? I can imagine this is just quite a moment in your career.
Yeah, I actually, when I was in Chicago training, I participated in the Ebola kind of preparations, being one of the hospitals that would have accepted Ebola patients had they have come our way. And that was interesting and new to me, but this is like nothing else I've ever experienced before. So my life now is full of meetings and conference calls, like we were talking about before. I still see patients in the hospital with other infections. Other infections don't cease to exist just because coronavirus is here. But my participation with our COVID patients is more on an administrative level, and as far as protocols, again, how we're going to treat, our testing abilities, and the difference is, instead of seeing patients kind of all day long, now I'm participating in the planning of making sure that our community is well cared for.
Mm-hmm. What advice do you have for people who may need to access healthcare that is not related to COVID-19? I know there's a lot of discussion going on right now about trying to stay away from the hospital if you can, and I think people are fearful of getting into an accident or getting sick and potentially having to go to a hospital, and contributing to that overwhelming of the system.
Right, and we appreciate people being cognizant of not wanting to overwhelm the system, but first and foremost, if you have an emergency, if there is something that, if you are having chest pain or shortness of breath, or you have an accident, of course, we always want you to come to the emergency room to seek care. That does not stop just because of the pandemic. Mm-hmm. So don't fear coming to the emergency room if you need help. If there is a situation happening that does not warrant or require emergency care, what we always recommend is that you call your Mercy Health provider or your physician, and they will help guide you as to the appropriate steps to take. We do have clinics that are reserved for people who are having fevers and who are showing symptoms of potential coronavirus. And then we have clinics that are available for patients who maybe broke their finger or had another situation happen that has nothing to do with coronavirus. Mm-hmm. If you don't have a doctor, we ask, if you do have access to the web or to the internet, that you visit the Mercy Health website, and there's a Find a Doctor link that you can click on there, and we can help you that way. And then another option that we have available that we've really ramped up for the last couple of weeks is virtual visits. So that's something that's been happening across the country in different areas. And we were doing some of that here in West Michigan, but now we are doing thousands of visits that way. And I think from my understanding is physicians, providers, and patients really appreciate being able to talk to their provider via a computer or a cell phone. And get the answers they need. Prescriptions can be given that way. It's been really beneficial as we distance ourselves.
That's great. So there also seems to be a bit of confusion surrounding how to get tested if you are experiencing COVID-19 symptoms. So what steps should people take if they suspect that they have it, and what can they expect from the diagnostic process?
Yep. So again, if you are having significant or severe shortness of breath, if there's anything that's concerning at all, we ask that you come to the emergency room to be evaluated. What we've set up at the emergency room is actually screening tents, so that when you present there, you actually see a provider outside of the hospital, and they evaluate you there, because we're trying to do everything we can to keep anyone who potentially has coronavirus, who isn't sick enough to be admitted, out of the hospital, to protect themselves, to protect the patients that are there, and to protect staff. So if you either need to be seen in the emergency room, we would recommend that you come there, and you can either get admitted or evaluated. If your symptoms, if you're having a cough and a fever, you're feeling tired, you're concerned that you may have been exposed to coronavirus, you have it yourself, then we would ask that you call your healthcare provider, and they'll assist you with the next steps. There's been a lot of work with primary care offices with regards to how we can test the community. And so what they do is, if I were a patient and I needed to be tested because I was concerned, I would call my doctor or my provider. They would call our testing tent, which is a drive-through tent that we have set up in the West Michigan area. We have a couple of them in the West Michigan area. The tent would then call me, the patient, back with a time to come and get tested. Okay. It's a drive-through test. You don't even get out of your car. It only takes a few minutes, and then you drive right home. And the result of that test should come back within 24, sometimes 48 hours. So it's very quick compared to where we were a couple of weeks ago. We do have some virtual screening. That can be, if you want to be screened virtually, we have a website. It's www.mercyhealth.com/COVID, that's COVID-19. And then there's also a hotline that you can call if there's any concerns about potentially being tested. Maybe you don't have a primary care doctor. And that number is 833-247-1258.
Wonderful. Great. Those are great resources. And that having everything else set up, I think really reflects the hard work you guys have been doing to meet this and try to create a positive outcome for the community.
Yeah, before 3 or 4 weeks ago, testing was taking weeks to get a result back, and now it's taking a day. I mean, it's the amount of work everyone has done is it's really incredible to be a part of.
Well, Danny, thank you for lending us your time and your expertise and your insights. Is there anything else that you'd like to say about what's going on right now in the world and what you hope for the future as we come out of this?
Yeah, we will get through this. I think that everyone doing their part in recognizing that their own actions are directly affecting everyone else in the community. I think taking ownership of that is very important right now. You don't want your mother or someone else's mother or grandmother or grandfather, whoever, to get sick. So just taking ownership of that and responsibility is very important right now. Again, we will get through this. We just don't know exactly when life will get back to normal, but hopefully sooner than later.
Mm-hmm. Awesome. Thank you so much.
Thank you.
Thanks for listening. As Dr. Pellegrini said, we are all depending on each other. Our actions have a direct impact on others, and we're going to get through this. I hope you have a great weekend. Weather's supposed to be a little nicer than it's been this week, and I hope that you find some activities that give you respite from the anxiety or the fear that you may be feeling right now. To stay in touch with us, please visit www.womenslifestyle.com and sign up for our newsletter. You can also listen to this podcast on YouTube. Our YouTube channel is Women's Lifestyle, all one word. If you have any ideas for a podcast episode or if you'd like to hear from someone we haven't interviewed yet, please reach out to me at elyse@womenslifestyle.com. That's Elyse at womenslifestyle.com. I hope you are all staying healthy and staying safe, and thank you so much for listening.